Assalamu alaikum my dear students. Once again welcome to my YouTube channel by the name MS Lectures, and today I would be demonstrating you about a very important topic of the normal physiology, which is the Starling forces. So I will be telling you about the types of the Starling forces and its importance. So first of all you must need to denote that the following terms. First of all, the pressure, and then the colloid osmotic pressure. That what is the difference between the pressure and the colloid osmotic pressure. So whenever you would see this word pressure, so you must need to keep in mind this fact that this pressure would indicate that the fluid would be propelling, or it would be excluding out of the particular name that is being associated with it. Like if it is capillary associated with this pressure term, so it means that this pressure is forcing the fluid to come out of the capillary. Furthermore, if we talk about the colloid osmotic pressure, so this colloid osmotic pressure actually is actually demonstrate us that the fluid should remain where it is. Like if you talk about the interstitial fluid that is associated with this term colloid osmotic pressure, so it means that this colloid osmotic pressure would keep that fluid in that particular region. Okay, so this is the pressure difference between the pressure and colloid osmotic pressure. That pressure, simple pressure, would actually will cause to propel that particular fluid out of that region, and colloid osmotic pressure would tend to keep that fluid in that region. So talking about first of all capillary pressure, so capillary pressure means that it will actually you can say force the fluid to come out of the capillary. Furthermore, talking about the interstitial fluid pressure, so this pressure would actually force that fluid to come out from the interstitial space. And then interstitial fluid colloid osmotic pressure, so this interstitial fluid colloid osmotic pressure, so it means that this colloid osmotic pressure would tend to keep this fluid into the interstitium. So interstitial fluid pressure, in this term we have studied that this pressure would try to propel out the fluid from the interstitium into the capillary. But in this interstitial fluid colloid osmotic pressure, what would happen that this colloid osmotic pressure would force that fluid to keep in the interstitium, so into the interstitial space. Now capillary plasma colloid osmotic pressure, so in the capillary plasma colloid osmotic pressure, so as you know that as you are seeing that capillary is associated with the colloid osmotic pressure. So as the term indicates, colloid osmotic pressure, it would force that fluid to keep inside to remain inside the capillary. So these were the four types of the Starling forces. Now I will tell you about their values. So first of all, talking about the capillary plasma colloid osmotic pressure, this is 28. So this 28 value would actually force that fluid to remain inside the capillary. Then interstitial fluid colloid osmotic pressure is this value is 8. Then interstitial fluid pressure, that is the -3. So minus sign indicates that, so minus sign would actually tell us that would actually reverse that function, because as you know that the pressure word always indicates that the fluid would be propelling out of the interstitium, but as there is the negative sign in it, so negative sign would reverse that function. It means that this pressure would do not propel out the fluid from the interstitial space, but it would cause that fluid to remain inside the interstitial space. So this negative sign actually reverses the function. This capillary pressure is 17.3. So now what these values indicate us, as you know that this 28 value, it means that this value forces the fluid to remain inside the capillary. So that is value that this value is 28. Now summing up all the other values, like 17.3 capillary pressure, 3 and 8. So summing up, we have 28.3. so this value actually forces the fluid to expel or propel out from the capillary. So as it is evident that this value is greater than this 28. This is 28.3, this is 28. This means that the force that is propelling out the fluid from the capillary is greater than the force which is keeping the fluid inside the interstitial space. So that's why, due to this difference in the pressure value, it means that as the value is higher, so fluid can be expelled out from the capillary in order to provide nutrients to tissues. So that's why this value is higher. Which value? The value which is propelling the fluid out of the capillary into the interstitial space, is this value is greater. Why it is greater? Because the fluid has to be transported out of the capillary into the interstitial space in order to provide nutrients to the tissues. So that was my whole lecture about the Starling forces, and hope you have understood it well. Last but not the least, don't forget subscribing MS Lectures. Thank you.